Apart from God, the next person I believe is Dr. Ashinoff. My name is Bidemi Awojabi. I'm Dr. Ashinoff patient.
I'm Dr. Ashinoff. I'm the director of the Center for Lymphedema Surgery in Shrewsbury, New Jersey. We're going to talk a little bit today about a patient of mine named Bidemi Awojabi. She developed left lower extremity lymphedema for no discernible reason in 2014 when she was overseas. Her workup didn't come up with any cause. There was no filarial infection. She didn't have any surgery or radiation.
I didn't really take it serious because I believe maybe it's something that will go at the end of the day. So when I traveled to Dubai, they told that was the same 2014 I traveled to Dubai and they diagnosed that for me. But after that, they gave me a shot, which I showed Dr. Ashinoff, the shot they gave me in Dubai. That really reduced the leg. But when I got back to Nigeria, the leg started swelling back. So I was really, really scared. So it wasn't that big, so I didn't really take it serious. So but when I got here in US 2017, when I was pregnant, so the weight and everything was really crazy. So that's when I decided to go online to look for the doctor. Nobody recommended Dr. Ashinoff for me. No. I just went online. I think I saw one of his videos. Then that is when I was like, I think this is the best doctor for me. And I just have that confidence in him. It really affects me. I told you, I can't make friends. I can't go to beach because I always feel bad that, oh, everybody's looking at me. So that really always drives me crazy. And at times when I see my baby, because I know something about my baby, he's always particular about that leg. He always touch that leg, kiss the leg. I always feel bad that, God, where would this stop? I don't want this boy to grow and see this kind of a condition. When I called Dr. Ashinoff, someone picked up my phone and she was like, she's going to call me back. And I was shocked. She called me back the other day, like, oh, can you come in February 24th? I was crying that, wow. I walked in, I saw him. And it was so, I don't know how to put him. There's nothing like discrimination, maybe because he's white and black. No, he treated me as if I'm a human being. That's how he treated me, and I was so happy.
So I did some diagnostic testing where we looked at the lymphatic pattern of drainage in her leg and it was noted to be abnormal. The dye that was injected through a test called spy lymphangiogram showed that the dye was pooling in the leg and there were no visible lymphatic channels. So we talked about different options, and I felt that she would benefit from a combined approach where we address the physiologic cause of lymphedema by transplanting or transferring lymph nodes from one part of her body to another, and also deal with the symptomatic at the same time by performing liposuction on her leg and reducing its volume.
So Dr. Ashinoff was like, now you have to go for therapy first. Let me see how everything is going. So I went for the therapy for like 6 weeks. So after the therapy, I called him to let him know that Dr. Ashinoff had been there, but I didn't really see any progress. Like maybe after like a month, then he told me, are you ready for the surgery? I was scared, to be honest with you. I was really panicked. But he said that would be the best thing to do.
So she went through the surgery and had a great result. What makes this a little bit unique is that usually we'll do either the physiologic surgery, meaning the lymph node transfer, or the liposuction, and then do the other one at a separate time. But I felt that the microsurgical portion went so well that I felt comfortable doing the liposuction at the same time. So she would be expected to have a both long-lasting and immediate improvement. So when we compared her measurements from before her surgery to after her surgery, there's a great improvement. And when you review the pictures, you can see. Additionally, her quality of life is greatly improved. She's one of my happiest patients, and she's back to work and doing everything she wanted to do. She does have to continue compression, but she's always been really compliant with that, which makes her a great candidate for liposuction. Patients who have liposuction have to compress. Otherwise, the leg will swell again, but she's been doing really well, and she and I are both really happy with her result.
My normal size is medium, but I can't wear medium. I have to start looking for 3XX, sometimes like 4X. Then I will need to adjust my right leg. So, but now I can wear medium. Look at my jean now. I'm so happy that I found him. I feel much comfortable now. I can wear whatever I want to wear. I don't feel shy anymore. No. God bless Dr. Ashinoff for me. I would advise anyone that is going through this pain to just go for the surgery. It's the best.